Joining us now is Dr. Lawrence Hoffman with Stanford Healthcare. And Dr. Hoffman, thanks so much for joining us this morning and talking with us. So we know that you've launched a new survey that predicts COVID-19 surges. Tell us about that.
So actually, this is a survey that we hope will predict outbreaks. We're still working with our epidemiology colleagues. And so the survey came about a month and a half ago when we had only tested 35,000 Americans, which was really inadequate to predict what type of surge we were going to see at Stanford or nationally. And the problem with that is when you test somebody, they've actually had symptoms for probably 4 or 5 days. It takes 2 or 3 days to get the test results back. So now you're 7 or 8 days into the illness. The big problem is you get into the hospital, you get admitted about 10 days after you've had the infection start. So we've lost our 10-day window before people show up at the hospital. So if we could get the symptoms as soon as they start, then we could predict, hopefully, 10 days out where there will be surges. So it's a survey. It takes 1 or 2 minutes to fill out. You just put in your zip code and your phone number and answer a couple quick questions. And then every day you get a reminder, and it takes only about 10 or 20 seconds to fill them out.
Well, we know some Bay Area counties, they're moving deeper into phase 2 of the state's reopening plan. Can you tell us more about the phased approach to easing the stay-at-home orders?
Yeah, so I think our public health officials here in Santa Clara County, by Dr. Sarah Cody, as well as the leadership by Gavin Newsom, has been really exemplary. I think we're all fortunate as Californians to have great leaders that are monitoring this. And they're slowly what happened was we saw this infection, we turned the spigot off, completely off, stay at home, shelter in place. And now we're slowly cranking that up, just letting a little bit of water out and seeing what happens. Are we going to get overwhelmed? And so I support the staged approach that they're doing. But what we want to do is quickly find out, are there clusters in certain areas that pop up? And by using the survey, you can wake up the next morning like, wow, I have the sniffles, I have the sore throat. My brother has that. We were both at a Memorial Day party. Let's report this in. And if we see that kind of grow and blossom, we would worry that potentially could be a hot spot.
Well, based on the data, do you think Napa, Sonoma, and Solano counties are in fact ready to move deeper into phase 2?
We are still analyzing our data. The biggest problem that we're having right now is to make sure that we have enough people answering it. Across the country, we've had over 2 million people come to the site and start our survey. And the key thing is to have people engaged every day. We're up to about 100,000 people that report in their symptoms every day and have been doing for almost a month. And so up in the North Bay counties, we don't have enough granularity at this point, and we're still working actually here, quite frankly, in the South Bay to understand exactly the correlation. We are seeing an overall decrease in symptoms nationally, which fits with the testing and the hospitalization data. But to be able to really pinpoint it, we really just need more engagement to have everybody do their civic duty. Everybody wants to do something to help doctors, nurses, frontline workers. This is something that you can do to really protect us.
I asked you about the North Bay counties, but you're saying that you're still monitoring all of the rest of the counties in the Bay Area too, right?
Right. The surveys nationally, our biggest uptick has been in Santa Clara County. That's, my network, my wife's network, my collaborator, Dr. Steve Goodman's network. But Stanford Healthcare has invested actually some significant resources to launch this, as well as Stanford Medicine. And we are going to be kicking off a digital campaign next week to really target parts of California that we think they're going to be surges, or we know there's active cases right now, to really see if the epidemiologists can hone the model to really predict where we're going to see these outbreaks.
What about the racial disparities we're seeing in COVID-19 patients? We know the governor has talked a lot about that. What do you make of that?
Yeah, that's really concerning, and it's kind of why we built the survey we did. It's not an app that you have to download and have an expensive smartphone or a data plan. it's a link, and we're trying to get funding so that actually people that just have a regular phone can SMS back our answers, because I was really worried about the health disparities that occur in our country and, quite frankly, globally. So if you look at the Latino population between the ages of 18 and 49, and this is data that was on the California Department of Public Health website, that I had reviewed. So 18 to 49, they account for about 40 to 45% of the population in the state of California, but they're accounting for 70% of the deaths. So 40 to 45% of the population, but 70% of the deaths. And so, the population that actually seems to be, thank goodness, very protected, regardless of your race, is young people, 17 years of age and younger. There actually have been no reported deaths in the state of California, according to the Public Health Department website.